You wake up in the morning, reach for a glass of water before you even check your phone, and your mouth feels like sandpaper. You figure, okay, maybe I just slept with my mouth open. No big deal. But what if that dry mouth you keep brushing off every single morning is actually your body sending you an urgent signal? What if it's not about sleep at all? Here's the thing most people don't realize. Waking up with a dry mouth consistently is one of those quiet symptoms that hides in plain sight. Doctors see patients every week who have been living with it for years, chalking it up to nothing, while underneath the surface, something real is going on. And today, we are going to break all of it down. Where dry mouth actually comes from, what it tells you about your health, why it gets worse as we age, and exactly what you can do about it, starting tonight. So let's get into it. Your mouth is supposed to produce saliva all day and all night. Most people don't think about saliva at all. It's just there. But saliva is doing an enormous amount of work every single moment. It's neutralizing acids that would otherwise eat away at your tooth enamel. It's washing away bacteria before they can settle in and multiply. It's helping you digest food before it even reaches your stomach. And it's keeping the soft tissues in your mouth, your gums, your tongue, the insides of your cheeks, moist and protected. When saliva production drops, even slightly, all of that stops working properly. And your mouth becomes a very different environment, drier, more acidic, and far more hospitable to the bacteria that cause tooth decay, gum disease, and bad breath. So when you wake up dry every morning, what's really happening is that your saliva glands were either not producing enough overnight, or something was actively working against them while you slept. Now here's where it gets more interesting. Because the causes of dry mouth at night are not all the same, and knowing which one applies to you changes everything about how you handle it. One of the most overlooked causes, and genuinely almost nobody talks about this one, is mouth breathing. A huge percentage of people switch from nose breathing to mouth breathing the moment they fall asleep, and they have absolutely no idea it's happening. When air flows through your mouth for 6, 7, 8 hours straight, it dries out every surface it touches. This is not a saliva production problem at all. Your glands may be working perfectly fine. The problem is mechanical. The air is evaporating the moisture faster than your body can replace it. But here's what makes mouth breathing more than just a comfort issue. Breathing through your nose filters and humidifies the air before it reaches your lungs. Your nose is lined with tiny structures called turbinates, and they warm and clean each breath on its way in. When you bypass all of that and breathe through your mouth, you're pulling unfiltered, drier air straight down into your airways. Over time, this puts stress on your respiratory system and has been linked to poorer sleep quality, more frequent nighttime awakenings, and even changes in blood oxygen levels. And what causes the mouth breathing in the first place? Often it's nasal congestion, chronic allergies, a deviated septum, or just inflamed nasal passages that never got properly addressed. Your body naturally seeks the path of least resistance when you're unconscious, and if your nose is even partially blocked, your mouth takes over. So if your dry mouth comes with snoring, if you wake up with a sore throat, or if you often feel tired even after a full night of sleep, that's a pattern worth paying attention to. Your body is trying to tell you something about the way you're breathing when nobody's watching. Now let's talk about something that affects tens of millions of people and is one of the single biggest drivers of dry mouth, and that's medication. This is the one that really surprises people when they first hear it, because the drug they've been taking for years for something completely unrelated turns out to be the reason they reach for water every single morning. There are over 400 common medications that list dry mouth as a side effect. That number is not an exaggeration. Antihistamines that people take for seasonal allergies, antidepressants, blood pressure medications, anti-anxiety drugs, bladder medications, even over-the-counter sleep aids and certain cold medicines. Most of them work, at least in part, by blocking signals in the nervous system, and your saliva glands happen to respond to those same signals. So when the medication quiets down those pathways, saliva production goes quiet too. The tricky part is that nobody tells you this when you pick up your prescription. You get a long printout of side effects, and dry mouth is buried somewhere in the middle, listed in small print right between headache and dizziness. People see it, they don't take it seriously. And then 2 weeks into the medication, they're waking up parched every morning and have no idea the two things are connected. If you're on any kind of regular medication, especially if you've been on it for a while, it is absolutely worth having a conversation with your doctor specifically about this. Not to stop the medication, not to switch to something else without guidance, but just to understand whether what you're experiencing is a known side effect, whether the dose could be adjusted, or whether there's something that can be done to protect your mouth while you're on it. Here's where the science gets really eye-opening. Saliva production is directly controlled by your autonomic nervous system, the part of your nervous system that runs everything automatically without you having to think about it. Heart rate, digestion, breathing, saliva flow, all of it. And here's the key thing. Your autonomic nervous system has two modes. There's the sympathetic mode, that's your fight or flight state, high alert, stress response. And there's the parasympathetic mode, rest and digest, calm, recovery, repair. Saliva production ramps up in parasympathetic mode and slows way down in sympathetic mode. Think about it. When you're scared or anxious, your mouth goes dry almost instantly. That's not a coincidence. That's your nervous system diverting resources away from digestion and salivation because it thinks you need to run or fight, not eat. Now think about what happens to a lot of people when they sleep. If you're someone who goes to bed stressed, who lies awake with your mind racing, who wakes up in the middle of the night with anxiety, your nervous system may not be fully dropping into that parasympathetic recovery state the way it should be. You may be spending significant portions of your sleep in a low-grade stress response. And one of the signs of that is waking up dry. Research has shown that chronic psychological stress measurably reduces salivary flow rates. Studies measuring saliva output in people with high stress versus low stress found significant differences, not just in how much saliva was produced, but in its composition. Stressed individuals produced saliva with higher acidity and lower concentrations of the protective proteins that fight bacteria. So the damage isn't just from having less saliva. The saliva that is there is doing less of its job. There's another warning this symptom can carry that is genuinely important to understand, and this one is about blood sugar. Persistent dry mouth, especially when it's paired with increased thirst during the day, frequent urination, fatigue, or blurred vision, can be an early sign of elevated blood glucose. This is one of the ways that undiagnosed or poorly controlled type 2 diabetes first shows up. When blood sugar is high, the kidneys work overtime trying to filter the excess glucose out through urine. That means more fluid leaving the body, which leads to dehydration, which directly reduces saliva production. At the same time, high glucose levels change the environment in the mouth, creating conditions where certain bacteria thrive and saliva becomes less effective at its protective job. This is not meant to alarm anyone, but it is meant to make you take this seriously. If you've been waking up with dry mouth for weeks or months, and you also find yourself drinking a lot more water than you used to, or you're getting up at night to use the bathroom, please don't wait on that. A basic fasting blood glucose test is simple, affordable, and something your doctor can order in minutes. Catching elevated blood sugar early gives you enormous ability to turn things around through diet and lifestyle. Catching it late changes the conversation entirely. Let's also talk about dehydration, because while it sounds obvious, most people are chronically underhydrated in a way they don't recognize. Not dramatically dehydrated, not so thirsty they feel sick, just quietly, steadily not getting enough fluid throughout the day. And by the time you go to bed at night, your body is already in a mild fluid deficit that your salivary glands feel immediately. Here's the thing about thirst. It's a lagging indicator. By the time you feel genuinely thirsty, you're already somewhere between 1 and 2% dehydrated. That sounds small, but research shows that even at 1% dehydration, cognitive function starts to drop, energy dips, and, you guessed it, saliva production goes down. So if you're going through your day drinking coffee in the morning, maybe 1 glass of water at lunch, and then nothing after that, you are not hydrated enough. And your mouth is going to tell you that every morning. The standard advice is 8 glasses of water a day, but that number doesn't account for your body size, activity level, climate, or whether you're eating water-rich foods. A better marker is your urine color. Pale yellow? Good. Darker yellow? Drink more. If you're consistently seeing dark yellow urine in the morning and then waking up with dry mouth, those two things are almost certainly connected. Now let's get really practical, because knowing all of this is only useful if you do something with it. The first thing you can do, and this one is free and starts tonight, is to prop yourself up slightly while you sleep. Sleeping completely flat, especially on your back, encourages your mouth to fall open. Elevating your head by even 10 to 15 degrees keeps your jaw in a slightly more closed position and reduces the chance of mouth breathing. A simple wedge pillow works perfectly for this, or you can layer a regular pillow underneath your existing one. A lot of people notice a difference in their morning dryness within the very first night. The second thing, and this one sounds almost too simple, but it genuinely works, is to drink a full glass of water in the 30 minutes before bed. Not right before you brush your teeth, not sipped casually throughout the evening. A real, deliberate glass of water before you sleep. You want to start the night hydrated rather than trying to recover from a deficit. Many people also benefit from keeping a glass of water on their nightstand so that if they do wake up feeling dry, they can immediately rehydrate without fully waking themselves up. Third, look at what you're doing in the 2 to 3 hours before bed. Alcohol is a significant contributor to nighttime dry mouth that most people underestimate. Alcohol is a diuretic, which means it makes your body lose more fluid. It also relaxes the muscles of your throat and tongue in a way that promotes mouth breathing and snoring. If you're having a drink or two in the evening and then waking up dry and groggy, those things are directly connected. Even reducing alcohol to earlier in the evening, say finishing by 6 or 7 p.m. rather than right before bed, can make a meaningful difference. Fourth, run a humidifier in your bedroom. This one surprises people because they don't think of air moisture as being related to their mouth moisture, but it absolutely is, especially in winter months when heating systems pull moisture out of indoor air, or in naturally dry climates. The air in your bedroom can have humidity levels that actively dry out your mouth and airways as you breathe overnight. A basic cool mist humidifier running while you sleep keeps the air at a humidity level where moisture isn't being pulled from your body. Aim for somewhere between 40 and 60% relative humidity. It can also improve the quality of your breathing, reduce nasal congestion, and make your skin feel better in the morning. Fifth, look honestly at your caffeine intake. Caffeine is something people think of as just an energy booster, but it's also a diuretic and a stimulant that keeps your nervous system in a more activated state. If you're drinking coffee or caffeine-containing drinks in the afternoon or evening, you may be both dehydrating your body heading into nighttime and keeping your nervous system from fully dropping into that parasympathetic, saliva-friendly rest state. Cutting caffeine off after 2 p.m. is a commonly recommended threshold, and many people find that their sleep, and their morning dry mouth, improves noticeably within just a few days. Sixth, try nasal breathing exercises before bed. There's a whole body of practice around training yourself to breathe through your nose, and it doesn't have to be complicated. One of the simplest things is nasal rinsing before sleep using a saline rinse or neti pot. This clears out allergens, reduces inflammation in the nasal passages, and makes it physically easier for your nose to be the primary breathing path while you sleep. Another approach is something called mouth taping, and yes, it sounds unusual, but there's actually solid research behind it. Using a small piece of surgical tape or specially designed mouth tape placed loosely across the center of the lips gently encourages nasal breathing during sleep without being restrictive. Many people report dramatic reductions in morning dry mouth within the first week. Seventh, and this one is about protecting your mouth directly, talk to your dentist about a saliva substitute or oral moisturizing gel. These products are specifically designed for people who deal with dry mouth, and they work by coating the tissues in your mouth with a protective, moisture-retaining layer that doesn't just make you feel better for a few seconds the way water does, but actually stays in contact with the tissues for extended periods. Biotin and similar brands make gels, sprays, and even overnight rinses. They won't fix the root cause, but while you're working on that, they can meaningfully protect your teeth and gums from the damage that dry mouth causes overnight. Now let's clear up a few things that a lot of people get wrong about this. One of the biggest myths is that dry mouth is just a normal part of getting older, that it's inevitable, that it just happens and there's nothing you can do about it. This is not true. Yes, saliva production does tend to decrease somewhat with age. And yes, older adults are more likely to be on multiple medications that affect saliva flow. But dry mouth is not a guaranteed part of aging. It is a symptom with causes, and causes can be addressed. When older adults work with their doctors to review their medications, improve hydration habits, and address underlying conditions, dry mouth often improves significantly. Accepting it as inevitable means never investigating what's actually behind it. Another very common misconception is that mouthwash helps with dry mouth. A lot of people reach for mouthwash when they feel dry because it feels like it should help. But the majority of commercial mouthwashes contain alcohol, and alcohol dries out your mouth. Using an alcohol-based mouthwash to treat dryness is a bit like trying to put out a fire with lighter fluid. If you want to use a rinse for dry mouth, specifically look for alcohol-free formulas designed for dry mouth, or just skip the mouthwash altogether and focus on the actual causes. And then there's the idea that dry mouth is purely a comfort issue, that if it's not causing pain, it's not causing harm. That's simply incorrect. Dry mouth is one of the leading drivers of tooth decay in adults. Cavities that appear on the root surfaces of teeth, a pattern called root caries, are strongly associated with reduced saliva. Gum disease progresses faster when bacteria aren't being regularly cleared by saliva flow. Fungal infections like oral thrush are far more common in people with dry mouth. The absence of discomfort does not mean the absence of damage. This is a symptom that deserves real attention, even when it doesn't hurt. Now, all of that said, if you have been waking up with dry mouth regularly, especially if it's been going on for more than a few weeks, please make an appointment with your doctor. Not because something is definitely wrong, but because some of the underlying causes, unmanaged blood sugar, sleep apnea, autoimmune conditions affecting the salivary glands, or medication interactions, genuinely need a professional evaluation to catch and address properly. Your dentist is also an excellent first call because they see the effects of dry mouth on your teeth before almost anyone else does and can help guide you in the right direction. Don't wait for a symptom to become a serious problem before you take it seriously. You came this far. You clearly care about your health. Follow through. If this gave you something to think about or opened your eyes to something you've been overlooking, give this video a like. It genuinely helps more people find this kind of information who really need it. Subscribe if you haven't already, because we go this deep on health topics every single week in a way that's actually designed to help you understand your body and not just scare you. And drop a comment below. Have you been waking up with dry mouth? Do you know what's been causing yours? I genuinely love to hear what you're experiencing. In the next video, we're going deep on something that affects a surprising number of people after 40. What it really means when your legs cramp up at night, and why the standard advice about bananas might not be the whole story. You're not going to want to miss that one.